Welcome to part 2 of cat behavior and handling, challenging behaviors. In this section, we'll build on the body language skills covered in part 1 and discuss some of the more challenging behaviors you may encounter while volunteering. We'll review how cats with behavioral concerns are designated within the shelter, as well as common behaviors such as overstimulation, inappropriate play, play aggression, and fear-based behavior. You'll learn how to recognize these behaviors and how to interact safely and appropriately with cats displaying them. We'll also cover when not to interact with a cat, when to alert staff, what to do if a bite or a scratch occurs, and how to respond during more serious cat-related emergencies. Finally, we'll introduce the cat safety bucket and the tools available to help keep volunteers, staff, and cats safe. The goal of this training is to help you recognize challenging behaviors early, respond appropriately, and build positive, safe interactions with the cats in our care. If a cat is categorized as blue, it is usually because they are either shy and fearful or easily overstimulated. These cats often have behavior evaluations and additional notes in the behavior binder or shared through volunteer communications. Before interacting with blue cats, it's extremely important to read all notes and evaluations so you understand that individual cat's needs and handling recommendations. Overstimulation in cats can start subtly and escalate quickly if we miss the early warning signs. Some common signals include tail swishing, flattened ears, tense posture, staring, skin rippling, pupil dilation, or turning the head toward your hand. If the cat continues becoming uncomfortable, behaviors may escalate into growling, swatting, scratching, or biting. It's important to understand that overstimulation is not a sign of a bad cat. It's a normal response when a cat becomes overwhelmed by touch, excitement, noise, or stress. When socializing with easily overstimulated cats, our goal is to keep them comfortable and below their stress threshold. Allow the cat to approach you first and avoid immediately reaching out to pet them. Start with brief, gentle petting around the cheeks and face area, then pause and allow the cat to decide if they want more interaction. Watch carefully for body language changes. If irritation appears, stop interaction completely and allow the cat time to calm down before re-engaging. Using toys is often a great way to redirect energy and reduce handling stress. Playful aggression is rooted in normal feline hunting and play behavior. Some cats may stalk, pounce, chase, bite, or grab at people during play, especially if they did not have enough social learning opportunities as kittens. Our goal is to redirect these behaviors appropriately onto toys rather than people. When working with cats who become overly excited during play, interactive toys are your best tool. Use wand toys, toy mice, or other objects that simulate prey movement. Avoid using your hands or body parts as toys, even jokingly, because this teaches the cat that biting or grabbing people is acceptable play behavior. At the end of play sessions, gradually slow the toy movement and allow the cat time to cool down before ending the interaction. If a cat playfully bites, calmly say no and briefly stop interacting. Avoid punishment or physical correction, as these can increase stress and damage trust. Cats learn through association. Behaviors that lead to positive outcomes are more likely to continue, while behaviors that cause interaction or rewards to stop are less likely to be repeated. This is why we focus on rewarding calm, appropriate behaviors and removing attention from unwanted behaviors rather than punishing the cat. Fearful behavior in cats can develop for many reasons, including lack of socialization, traumatic experiences, or simply adjusting to the stress of a shelter environment. Fearful cats are often highly sensitive to loud noises, sudden movement, unfamiliar people, and busy environments. Providing calm, quiet spaces and opportunities to hide can significantly reduce stress and help these cats feel safer. When working with fearful cats, patience is essential. Move slowly, avoid direct staring, and keep your voice soft and calm. Often, simply sitting quietly near the cat without forcing interaction is the best first step. Allow the cat to approach on their own terms. Gentle play with quiet toys can also help build confidence and positive associations with people. Not every cat is going to be ready for interaction, and it is important to respect a cat's choice to create distance. Do not attempt to pet, handle, or approach cats that are hiding, growling, hissing, yowling, lunging, swatting, or attempting to bite. These behaviors are the cat's way of communicating that they feel fearful, stressed, overwhelmed, or unsafe. When a cat displays these signals, the best response is to give them space and allow them to regain a sense of control over their environment. Pushing for interaction when a cat is communicating discomfort can increase their stress, damage trust, and increase the risks of scratches or bites. Remember that shelter cats are experiencing an unfamiliar environment filled with new sounds, smells, people, and routines. A cat that does not want interaction today may be much more social tomorrow. Our goal is not to force interaction, but to support each cat's emotional well-being by respecting their communication and allowing them to engage with us on their own terms. It is important to notify staff if you observe new behavior changes, signs of illness or injury, repetitive pacing or extreme stress, or any environmental hazards. If you are scratched or bitten by a cat, stop interacting with the animal immediately and safely end the interaction. Wash the wound thoroughly with soap and water as soon as possible, even if the injury appears minor. Prompt cleaning helps reduce the risk of infection. After providing first aid, notify a staff member right away and follow all shelter incident reporting procedures. Reporting injuries allows staff to ensure you receive appropriate support, evaluate the circumstances surrounding the incident, and make any necessary adjustment to the animal's handling plan. Remember that even small scratches or puncture wounds can become infected, particularly bites, which can introduce bacteria deep into the tissue. Watch for signs of infection such as redness, swelling, warmth, pain, or discharge, and seek medical attention if these symptoms develop or if you have concerns about the injury. Reporting injuries is not about assigning blame. It is an important part of maintaining a safe environment for volunteers, staff, and animals, and help us learn from incidents to prevent future injuries. Cats can occasionally escape from rooms or carriers, especially during busy shelter activity. If a cat escapes, stay calm. Running after or chasing the cat will usually make the situation worse. Instead, use soft voices, treats, or calm movements to encourage the cat towards safety. If a cat is not approachable, notify staff immediately. If a cat fight occurs, never place yourself between fighting cats. Loud noises like clapping or speaking firmly may interrupt the conflict, but staff should also be notified. The Cat Safety Bucket contains emergency tools used to help keep both cats and people safe during high-stress situations in the cat wing. These tools are intended for trained staff and volunteers and are used to support safe handling and de-escalation when necessary. Always remember, our first and best safety tools are prevention, calm handling, and understanding feline body language. Whenever possible, use the least stressful and least forceful handling method available. The more we respect a cat's emotional state and boundaries, the safer and more successful our interactions will be. Thank you for taking the time to learn more about challenging feline behaviors and safe handling practices. Your patience, awareness, and thoughtful interactions can make an enormous difference in reducing stress and helping cats feel safe while they are in our care.